Welcome back to Zoo Vet at Large.
At Flamingo Land in North Yorkshire, head keeper Ruth Wesly arrives to give new zebra Alec his breakfast. This morning the Longleat keepers are taking away stallion Spot to complete the zebra swap. Zoo Vet Matt is on hand in case Spot misbehaves when they load him into the trailer. If Spot doesn't play ball, he'll have to be tranquilised.
I don't know his mind. This is Ruth's animal until he gets back down to, or until he gets on the trailer. So Ruth knows him better than I do, so she can sort of call all the shots, and I'm turning Ruth's hands. But he's just going to walk on, Ruth.
Yeah, just going to walk on the trailer door. He's just going to walk on.
Close the door behind him.
That's it.
You've got to have this, that side.
No, I haven't got that one. That's done.
Oh, see, then slide it down onto that.
Oh, look, are you just going to have it now? Good boy. There's a good boy. There's a good boy. Are you going to have a look?
We'll just come out of his space, sorry. Just come out of his space a bit.
Good boy. Good boy. Good man. Right, move that door.
Exactly as I planned. So
Yeah.
well played. Well played, you. I have to tell you, there's 99 times out of 100 that would not happen.
With everyone pleased that Spot didn't let the side down, Matt can continue his round. In the reptile house, a new African sulcata tortoise is coming to the end of his quarantine. But Keeper Dean is concerned that all is not well.
So he's been passing blood from somewhere. So it is bright-eyed, isn't he? We might have to just turn him over for a minute. I think it's going to be the... That's where it's coming from, isn't it? Nasty smell as well.
Is it possible that there's an insect that's getting some free calcium off him?
We've only caught more bugs on him. I've sort of frozen. There's many old things. Yeah. Yeah, it's got lumps of pus. It's got to be septicemic. Okay. It's shell rot. I suggest that we wash those cavities out with F10, garlic F10, then stick a sticky plaster over them, just to stop any stuff going in it. But we need to get antibiotics into them. I've got to try and work out how.
It wouldn't be possible just to put it inside his mouth and let it fall.
All that will happen is he'll sit there, and you'll pump it in, and a few minutes later you'll see a dribble come out the side of his mouth. I've got the thing for keeping parrots and reptiles' mouths open, and you can then pass a stomach tube. And I think that this is about the only way we're going to do this.
Dean will raise the temperature and lower the humidity in the enclosure to get rid of the shell rot. This tortoise will also get a deluxe bed of hay to keep his shell off the ground. Matt will be back in a couple of weeks to check up on him. Flamingo Land keepers work closely with other wildlife parks, not only in this country, but around the world. When new animals are brought in, the keepers are alert to the possibility of disease, and Matt must move quickly if there are any suspicious symptoms.
We've got a bit of a challenging problem. We've got a new load of storks that come in. So we've got a nice big collection of storks. But unfortunately, some of them come in with a really nasty fungal infection in their mouth. It's a bit like having a raw thrush, but it's a really bad one. It's called geotrichum. So if you ever get that, panic. Right.
Matt will treat the storks with a common high street antifungal solution. But before he does this, He's got to figure out which stalks are infected.
Okay.
Before Matt can make a diagnosis, he's got to give the mouth a good clean.
See, that's just food, isn't it? Just food. Okay, you're alright.
Is that one?
Yeah, he can go.
He can go for
Okay. New one. Yucky doodah. Look at that. Nasty, nasty crustiness inside of little toes sort of stuff. Quite a lot actually. Right. You got the wet off there. But it's inflamed, you can see the redness. Yeah? Okay, let's have 9 mils. Yeah. It is an approximate dose. And then just slosh it round inside. Okay? Sam, if you trickle it in here, it's just going slowly past the open trachea, because I can't get him to close his trachea.
Getting the stalks back to full health is going to be a time-consuming business. The keepers will repeat this procedure twice a day for the next 2 weeks. After a busy morning at the zoo, Matt's on his way back to the surgery. But thanks to keeper Jackie, he's got an unexpected patient with him.
Well, last night my friend Pauline came over in a bit of a rush with a washing basket containing a Sparrow Hawk that was a bit dishevelled, and she said she'd found it in her hedge bottom. Be a road traffic accident, I would think. Might have been shot. Matt will know, I have no doubt, when he's had a look.
So back at the surgery on Sparrow Hawk. Broken wing is up in here, and actually possibly a bit unfortunately there might be a bit of bone sticking up through here, so maybe not. Anyway, we'll take an x-ray and we'll see what we shall see. The important thing about this bird is being a wild animal. We need to be able to be sure that we're going to be able to release it back to the wild. And being a hunter, it's got to have speed and agility, and unless its wings are going to be 100%, then there's no possible way we can release it back. And it's not fair to just take the wing off and keep it in captivity. It's a wild animal. It belongs in the wild.
Okay.
Matt examines hundreds of wild animals every year and can usually make a pretty quick assessment of how severe the injury is.
These do fix very well with an iron pin, but you start looking in here and you can see that the bone has at some point penetrated through there, so it's all going to be a bit infected as well. So I think this is not going to have a very happy ending in a minute.
And when the x-rays come back, things don't improve for the Sparrow Hawk.
This is really quite an old injury, and you've got a whole load of new bone has been attempted to be deposited here to try and repair it, apart from which its shoulder blade is damaged, and it looks like the top of its coracoid has got a fracture there as well. So I'm afraid to say that this bird is not to be, and we should put the bird to sleep. Which is the kind of thing for the bird, because if it hadn't been picked up and brought in, then it would have starved to death and died in a week or two. And although it seems harsh to put it to sleep, it's better that than it has a lifetime of living in a cage, which is not designed to do.
Matt's next patient has arrived. Rosie, an African grey parrot, has been brought in by her owners, the Barr family.
She's 12 years old, she's a family pet, she has a blocked nostril. She's the cutest pet you could ever want, really, because she just chats all the time. We don't teach her anything. When you have your dinner, what did you say afterwards? Do you want to yogurt? Yeah.
Matt is an expert in treating exotic birds. The Barrs have travelled over 100 miles from Lincolnshire to see him.
What do you feed Rosie on?
It's mainly we have a parrot mix, so it's
seed-based diet.
Seed-based diet.
Okay. If they eat a seed-based diet, fairly rapidly, and I'll bet you if you really looked at it, it's the sunflower seeds she loves. And the problem with that is that it's very high in fat, very low in vitamins and minerals. And the reason they develop these upper respiratory tract problems is because the immune system is not as good as it should be. And being vitamin A deficient, one of the signs of vitamin A deficiency is something known as, long word, I'm afraid, hyperkeratosis. It's an increase in the amount of skin epithelium, and they build up more and more layers of this slightly abnormal lining in their nostrils. Right, well look, what I'm going to do is I'm going to get a towel out and I'm going to catch her, and I'm going to take her through, and she's going to have a little anaesthetic. When she's asleep, I'm also going to take a blood sample from her, and I'm probably going to take a swab from in here and debung this lot and flush it out. Okay. All right. You go and have a seat. I mean, alternatively, if you want to go and walk into town, there's a coffee shop down at the bottom. There's fish and chip shop too.
Oh, she noticed that, yeah.
Okay. All right. Lovely. She's a lovely bird, but it's the same story. It's that people don't get good advice, and they think they're doing the right thing, and they love her to bits. It's quite obvious. But she's just totally addicted to sunflower seeds, and she's vitamin A deficient. So let's see if we can get her sorted out for us. Oh, it's not fair, is it? She says, you're a vet. Amazing how they know. Come on, then. You can see blocked nostril there. But this one's all fairly blocked up as well. That's it. Blah, 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 blah.
With Rosie safely under anaesthetic, Matt starts unblocking her nostrils.
And this is known as a rhinolith, a bogey to the rest of us. Where are those forceps? What I'm trying to do is to avoid giving her too much of a nosebleed. It's not coming up as I'd like it to have done in one big piece, but you might sort of thing one likes being better about, you know, because you get to just fiddle. Let's cut that out. Yeah, it's that big lump out. Pus, lots of pus in there still to come out. Well, the difficult bit is getting this pus out without driving it all just further and further in. There you go. Now we're getting somewhere, aren't we? It's one of those things that you begin to think, God, am I beginning to put this poor brains out? But no, fortunately, brains over there, so okay.
It's a happy ending for Rosie. All she needs to do now is take her vitamins, stay off the junk food, and she'll be almost as good as new. Next time on Zoo Vet at Large, we meet Matt's wife Claire, a horseback.
That's all clear. Very, very good.
And the Zoo Vet is down on the farm.
Check your cow's pregnant. We stick a hand up their backside.
They've raised some of Blighty's most famous faces, and now they're ready to whip other families into shape. Brand new Celebrity SOS is starting next over on Sky Live.
Goodbye!